Functional Physio presents ePoster 2020. Associated by Mind Academy and Sportson.
Presenter Biswajit Pasupalak. On title: Exercise during cancer treatment.
Hello everyone, myself Mr. Biswajit Paspalak. I am a third year student of SB Nirtar, Odisha. Today I am going to present you this poster which is based on exercises during cancer treatment. First, I would like to say about the relationship between obesity and cancer. As we know, tobacco is the number one cause of cancer, but obesity is also added to that preventive cause of cancer because of lifestyle modification. What are the causes behind it? The causes may be obese people often have increased level of insulin, fat tissue produces higher amount of estrogen, obese people often have chronic low level of subacute inflammation, fat cells that adipocytes may also have effects in on certain tumor growth regulator factor, which will cause endometrial cancer, esophageal adenocarcinoma, gastric cardiac cancer, liver cancer, kidney cancer, multiple myeloma, meningioma, or your colorectal cancer, gallbladder cancer, breast cancer, which is the main cause nowadays. The next thing I would like to say, the benefit of exercises. If a cancer patient will follow a well-designed exercises plan during and after treatment, then it will lower the chance of having physical side effects such as fatigue, neuropathy, osteoporosis, nausea. It may be reduce the risk of depression and anxiety. It will improve your balance to reduce fall injury, keep you as mobile as independent you want to be, prevent muscle loss and build strength, improve your sleeping capacity, prevent weight gain and obesity which are linked to increase cancer risk, reduce the risk of other cancers, make your treatment more effective at destroying tumor cells, decrease the amount of time you need to stay in the hospital, which is the main issue, improve which will improve your psychological effect, prevent other chronic diseases such as heart disease, diabetes. So these are the benefit a person will get if he or she will follow a well designed exercise plan during or after cancer treatment. The next thing I would like to say about the exercises. The exercises include breathing exercises, stretching, balance exercises, aerobic exercises, strength training exercises. What is there in breathing exercises? Some people with cancer may have shortness of breath. So it by doing breathing exercises, it will keep them from being physically active. Breathing exercises also help in move air in and out of the lungs, which can improve your endurance. These exercises can also help to reduce any type of stress or anxiety that cause your muscle to tighten. In stretching exercises, stretching regularly can improve your flexibility and posture. It will help in increasing the blood flow and oxygen to the muscle. It will also help your body to repair itself. Stretching is often helpful if you have been inactive while recovering from cancer treatments. For example, if a person is undergoing radiation therapy, can limit your range of motion and can cause muscle to stiffen. After surgery also, if a person is undergoing any type of surgery, it will stretching can break down the scar tissue. The next thing is balance exercises. The balance exercises will help that person to regain the function and mobility for activities of daily living. The balance exercises also can counter some of the effect of muscle imbalances and body asymmetry after surgery. It also prevent future injuries such as falls. What are there in a balance exercises? Standing on foot, tightrope, calf or heel raises, front, back and side leg lift or raises, or to improve the core strength, a person can do also pelvic tilt and bridging exercises for 5 to 10 repetitions. The next thing is aerobic exercises, also known as cardio. This is the type of exercise that raises your heart rate. It will strengthen your heart and lungs and can help you feel less tired during and after treatment. Walking is an easy way of aerobic exercises. For example, if your doctor may suggest walking 40 to 50 minutes 3 to 4 times per week at a moderate pace. The goal is to follow the US Center for Disease Control and Prevention aerobic activity guideline, which states that a person should do 150 minutes per week of moderate intensity exercise for adults, or you can do 75 minutes of vigorous intensity exercises. The next is strength training exercises. Stretching and strength training are two components of a fitness routine to help recovery after cancer treatment. Some tips are: consider your environment. That is, exercise at your home if your immune system is not strong. Gyms carry a high risk of infection. Then Focus on balance. Protect yourself from falls, which will prevent falling injury. Wear comfortable clothing and appropriate footwear. Exercise in a temperature controlled environment. Warm up, which is very important. That is, start with some deep breathing, then walk, march in place, or ride a stationary bike until your body feels warm. Then breathe, hydrate, that is, drink plenty of water, especially when you sweat. Move slowly and smoothly, rotate muscle groups, gradually do more, wait 48 hours between strength training sessions. Cool down, keep know your limit, that is, learn to tell the difference between the muscle fatigue and unusual pain. Stop if you feel pain. If something doesn't feel right, then stop it. Moving on to the next part, the best 5 tips. The first tip is learn about the physical activity recommendations, that is the duration of the exercises, that is 150-minute breakdown into 22 minutes per day, 7 day per week, or you can do 30 minutes of exercise 5 times per week. Moderate intensity exercise should leave you breathing heavily but able to carry on a conversation in short sentences. 75-minute breakdown to 15 minutes per day, 5 day per week. Vigorous intensity exercise is when you can answer a question during exercise but only in a word or two. Full body strength training, also called as resistance training. It is based on the exercise that create the muscle overload to stimulate new muscle to grow. The second tip is use a variety of exercises, that is the aerobic training. Activity like walking and running are great aerobic exercises. Then the resistance training. Activity like standing up from a chair or toilet, climbing stair and carrying grocery bag all require muscle. These are the good resistance training exercises. Core training exercises. What is core? The core training is the basis of movement. The core is the muscle around the middle of your body from just under the ribs to a few inches below where your hips bend are your core. These muscles are used in every single movement of your body. Then the third tip is train your life by using functional fitness. Example, if you need to bring laundry from one level of your home to the next, start by moving an empty laundry basket or small pile of towels multiple times to activate the needed muscle. Then the fourth tip is the remember to refuel your tank. Hydration and food are very much important, especially the protein is the key to recovery after exercise and resistance training. Exercise also help in improving the sleeping capacity, which also aid recovery. The fifth tip is find an accountability partner. That is another way to make your exercise program consistent is to tell someone close to you what your exercise plan is, then empower that person to encourage you by asking you about it regularly. It will improve your psychological effect. Moving on to the next part, the safety measures. It is important to take precautions while exercising. If you are having side effect from your cancer or its treatment, you have to change the exercise plan according to it. For example, if a treatment caused bone loss, you should avoid exercises that put strain on the neck and raise your risk of falling. So some tips are progress slowly, that is, even if you are physically active before your treatment, build up your level of activity slowly. This can help you to avoid injury. Exercise in a safe environment. If treatment has weakened your immune system, then home is the best place for exercise. Listen to your body. If your energy level is low, then adjust how long or how hard you exercise until you feel better. Stay hydrated. Drink plenty of water during workout to avoid dehydration. Eat a nutritious diet. The right food, especially the high amount of protein, will help you to recover after exercise. So that person should take help from an oncology dietitian. See your doctor regularly. This is very much important because your health can change throughout treatment. Make sure your doctor check for important health indicator such as your blood count. So if you know is there safe to do exercise or not. So here I want to say you some important points given by National Cancer Institute, that is the relationship between physical activity, that is exercise, and cancer. The exercise has many biological effects on the body, some of which have been proposed to explain association with specific cancers. These include lowering the level of sex hormones such as estrogen and growth factor that have been associated with cancer development and progression, which will prevent the breast and colon cancer. Preventing high blood level of insulin, which has been linked to cancer development and progression, which will again prevent to breast and colon cancer. Then by reducing inflammation, by improving immune system function, altering the metabolism of bile acid, decreasing exposure of the gastrointestinal tract to these suspected carcinogen, reducing the time it takes for food to travel through the digestive system, which decrease gastrointestinal tract exposure to possible carcinogen, which will prevent colon cancer, helping to prevent obesity, which is a risk factor for many cancers. So by doing physical activity, this can be prevented. Moving on to the last part, that is the cancer rehabilitation. The cancer rehabilitation defined as helping a person with cancer to help himself or herself to obtain maximum physical, social, psychological and vocational functioning within the limit imposed by disease and its treatment. Then I have also mentioned quality of life, which is defined as individual's perception of his position in life in the context of the culture and value system in which he lives, and in relation to his goals, expectation, standards and concern. The rehabilitation goals include restorative, supportive, palliative, preventive cares. The restorative care aims to return the individual to pre-morbid function with a minimum of functional impairment. The supportive care aims to reduce functional difficulties. The palliative treatment, usually of the terminal patient, works to eliminate or reduce complications, especially pain. Preventive rehabilitation would include, for example, pre-operative education regarding maintenance of strength and range of motion in the upper extremity following breast surgery. The problems due to radiation therapy is skin and soft tissue fibrosis. The effect of radiation will cause loss of elasticity, vascularity and moisture, tissue thickening and edema, contracture. So in the management we can use moisturizing creams, splinting and orthotics, stretching exercises. The management of fatigue also can be done by the bed rest or aerobic exercises, the activity program, the energy conservation technique, diversional activity, sleep patterns, stress management, nutritional management. The rehabilitation of pain can be done by physical modalities, that is electrical stimulation and heat modalities. Acupuncture is also an effective analgesic adjunctive method for cancer patients. The management of lymphoedema can be done by elevation, active exercises, compressive garments and pumps, manual lymph drainage, massage and other treatment. The rehabilitation of immobility, effect of immobility. The prevention of related problems is contracture and muscle atrophy. So the role of exercise and mobilization is very much important. The bone destruction can be evaluated by X-ray, bone scan and the CT. The management of pain can be done by unweighting, assistive devices, surgical consideration and the stability can be given by brushing. Splinting to maintain position, orthotic to restore function. Example is AFO to lock the knee during stance phase. Here, so I would like to conclude my presentation by saying of Edward J. Stiglitz, that is, the important thing is not how many years in your life, but how much life in your years. Thank you.